Hello, I'm Walt Dawson. I'm a health and aging policy researcher based at the Oregon Health and Science University School of Medicine in Portland, Oregon. I was a member of the 2018 cohort of Atlantic Fellows for Equity and Brain Health based at the University of California, San Francisco. And my work and research really is focused at the intersection of health policy, long-term services and supports, and brain health, particularly Alzheimer's disease and dementia. And my passion for this work really comes from a personal experience. My father was diagnosed with Alzheimer's disease when I was 8 years old. And as a result, I really spent most of my childhood and teenage years as a family care partner, which I think is a somewhat unusual role for a child to be in. But I also witnessed firsthand the many challenges and failings of the American healthcare system. And I think that this was very much a focusing point. And I became highly engaged with advocacy for people living with Alzheimer's disease and the need to build a better and more equitable healthcare system in the United States. And that advocacy began with writing letters. I wrote to elected officials, to the President of the United States, to members of Congress. I even wrote to movie stars. Really, I wrote to anybody who I thought might be in a position to draw attention to issues that were facing people like my father. And to make a long story short, at 10 years old, I found myself on an airplane flying from my home in Oregon to Washington, D.C. to testify before a congressional committee about my family's experiences caring for my father and the need for a far more equitable healthcare system in the United States, one where a person wouldn't have to lose everything or go bankrupt just so that they get the care that they needed. And while significant policy change or comprehensive reform of the system didn't occur at that precise moment, this was back in 1994 in the midst of the national healthcare reform debate that was taking place in the United States during the early years of the Clinton administration. I've come to realize how much that particular event and those experiences really have shaped my life and my work in public policy. So fast forward to 2009, I'm a graduate student working on my doctoral research focused on long-term care financing policy. And I'm offered an internship at the U.S. Senate Special Committee on Aging. That was the same committee that I had testified before nearly a decade and a half earlier. And during my time working at the committee, I had the opportunity to work on the components of the Affordable Care Act, particularly parts of the legislation that were focused on long-term services and supports and expanding access to home and community-based services. And after working on the Hill, I also worked in Washington, D.C. for a few other policy-focused organizations, and then also at the state level back in my home state of Oregon as well. Today, I'm based within an academic research setting. As an assistant professor in a school of medicine, I'm also based within the NIA Latent Aging and Alzheimer's Disease Research Center at OHSU, which is one of the 31 or so federally designated Alzheimer's disease research centers in the United States. And this pivot to the academic research role really took place through and as a result of the Atlantic Fellows for Equity and Brain Health. The intent being to try to better integrate my macro policy work in long-term services and supports and health policy with more kind of on-the-ground health services research focused on improving policy outcomes, but also improving care for people living with dementia and as well as the experiences of their family care partners. And the enhanced training, mentorship, and opportunities for collaboration with others who are also very interested and focused on reducing the impact of dementia, I think was also really essential to this pivot. And to that end, I received some funding from a couple different sources for studies, including my pilot award through the Global Brain Health Institute. That's are really kind of focused at this intersection of health services research, policy, better policy outcomes, and the better support of people living with dementia. But I would also say that the disproportionate impacts of COVID-19 on long-term service and supports, both on the individuals who receive care, as well as those who provide care, be it paid or unpaid care and support, have both been a real kind of focus of my work the past year or so. And for me, I think how public policy has shaped my life and work is very clear, right? But how policy directly shapes our lives and our work may not always be clear, but it certainly does. And I think policy is a powerful tool to advance social change and progress, particularly within brain health science. And this is true for someone who might be a researcher, or someone who is an artist, or someone who is a physician. There's really an opportunity to engage with policy within your work. But even if direct kind of engagement with public policy is not really a goal of your work, I think it's still essential to really understand how policy may affect your work and your goals. So I think just kind of one other body of work that I'd like to share with you today, that I've been helping to lead with a number of collaborators that include GBHI faculty and other senior fellows, is the development of a new framework that is really focused on advancing greater international collaboration in brain health, in what my collaborators and I are calling brain health diplomacy. And this new framework is really focused on bridging several well-established theoretical models, including health diplomacy, science diplomacy, and innovation diplomacy, and really connecting those with brain health science. And we began this collaboration before the COVID-19 pandemic began. But I think that the impacts of COVID-19 have really made abundantly clear the need for greater partnership and collaboration across countries and across disciplines and across sectors. I think this is true in terms of thinking about ways to kind of mitigate the pandemic broadly, but this is particularly true in terms of brain health and the increasingly clear impacts that COVID-19 has on the brain. And so the concept of brain health diplomacy is really based on the premise that it's necessary due to a multitude of threats to brain health at a micro level, a macro level, or meso level, and a macro level. The micro level being the individual, the meso level being the community, and the macro level being the national as well as the transnational or international level. And these threats really require a large-scale approach to influence global policy outcomes and global policy to bring about better brain health outcomes. And arguably, few other issues besides brain health will have as much of an impact on public health than in the 21st century. Really, few other issue areas will have, COVID aside, really have that impact on humanity as brain health, particularly if you consider not just the impacts of cognitive disorders on individuals, but at a kind of national or societal level in terms of cost and impact. I think that's very much the case. And so in a recent December issue of the Lancet Neurology, we were able to provide an overview of this work and this kind of model. But there'll be an opportunity later this year to engage with brain health diplomacy as a summer selective course as part of the fellowship. So I hope you'll be interested in participating. Thank you.